As healthcare workers, we offer our care and our experience to people at all stages of life, from infants to older adults. They are all individuals with their own feelings and abilities, but they grow and develop in similar ways. At each stage in life, there are certain qualities and needs that are shared, and by understanding what these are, we can provide better, more appropriate care at each stage. Age-specific care addresses the different needs people have at different ages. These series of programs will cover age-specific considerations for every stage of life, from neonates immediately after birth to those over the age of 80. This first program in the series will cover a number of general cultural and communications considerations that apply across many age ranges. Plus, it will look more closely at the age-specific considerations for neonates and infants up to 1 year of age. Later programs in the series will cover the later age ranges. By incorporating age-specific considerations into your care for each patient, you help identify and provide the care that particular person needs at that time of life. You help the person become an active partner in health decisions as much as the person's age makes possible, and you help your institution comply with accreditation standards established by the Joint Commission. Age-specific competencies have been a major focus of the Joint Commission. Healthcare staff need to be trained on how the age of each patient can impact assessment and delivery of care, plus health education needs for the patient and family. There are special health considerations to be aware of at each stage of life, and all healthcare staff should understand and apply these age-specific considerations. Being able to apply age-specific care often depends on an understanding of the patient's and family's culture and on using age-appropriate communication skills. We will address these issues first. America is a culturally diverse country and becoming more diverse all the time as new immigrants arrive and those already here raise families. The percentage of non-Hispanic whites in the population, the mainstream culture, is actually declining and is expected to be only 79% by the year 2020. In some areas, such as Southern California and several big cities, such as New York, non-Hispanic whites will soon become, or have already become, a minority themselves. You should be aware of the patient's culture, no matter what age he or she is. Cultural competence is a separate requirement of the Joint Commission and other professional bodies, but it obviously impacts care at any age. There are many cultural differences in beliefs, cultural practices, eating habits, physical environment, almost every imaginable kind of difference. And many of these can affect a person's health directly or affect the attitudes that define how health is maintained. The fact is that nurses and other healthcare providers in the United States still largely come from a white, non-Hispanic background, almost 87%. Many Americans, especially those who grew up away from the coasts or away from any large minority communities, thought they grew up in a largely monocultural society. In this case, a certain amount of ethnocentrism can be understandable. Ethnocentrism is the feeling that your own culture and its beliefs and practices are the normal ones or even the superior ones. Some aspects of cultural belief can be so deeply held and seem so natural that a provider is unaware that a patient may hold completely different views. Overcoming these feelings can be part of a lifelong learning experience, and more direct guidance is provided by the Department of Health and Human Services, or DHHS's standards for culturally and linguistically appropriate services, or the CLAS standards. The Joint Commission has addressed many of the same problems of cultural competence spread through a variety of its documents and policies. In general, both the DHHS and the Joint Commission insist that healthcare organizations should ensure that all patients receive effective, understandable, and respectful care. This can affect age-specific care as well. For instance, many cultures differ on the amount of deference they expect children and even teenagers and young adults to give to adults, and especially to their own parents. and they may have different views of the role of the whole family in making personal decisions. If you work with a minority community, you should learn when it is appropriate to work with the entire family on making medical decisions. And try to present health options in ways that take into account the cultural beliefs of the patients. Some cultures may hold utterly different views, for example, on nutrition and its role in health. There may be foods that are considered unclean or taboo, or are so unfamiliar that they could not easily be added to the diet.
So does your family have those same beliefs?
They may have different views on the role of, say, spiritual forces or other factors in maintaining health. For someone trained in the Western scientific model of medicine, with its emphasis on the germ theory of disease and the importance of biochemical processes within the body, other models of health may simply be inconceivable, and it could be all too easy to miss the signs that what should be a two-way street of provider-patient communication isn't running either way. The institution will provide forms of training to help providers understand the specific ethnic communities they serve and how beliefs and taboos may shape not just care in general, but care of children and all age-specific care. The institution will also explain where there are legal exceptions to including the family in a healthcare decision, for example, in cases of suspected abuse. In those cases, laws vary from state to state, but in general, you will be required to keep information about suspected abuse private from parents and report it to your local Child Protective Services. Pregnancy of a minor, too, can be a legal exception to including the family. You should consult your state's laws on when a minor's pregnancy must be kept private. In addition to strong cultural factors that can affect age-specific care, there may be direct language barriers. You should assess the patient's and family's primary language and whether communication might be clearer if you brought in a translator or interpreter.
Yo, el inglés casi no.
Also, check for any speech or hearing impairments and check whether any confusion or depression might be a sign of physical or mental illness. Find out if the patient is under stress or worried if healthcare decisions might affect school, the job, or family.
So do you understand?
With children and teenagers, check to see that the person appears to understand instructions at an age-appropriate level. One way to do this is to ask them to tell you what they understand about their disease or condition, or what was just explained to them. Culture can affect communication in ways beyond simple language barriers. Be aware of how eye contact and gestures that seem ordinary to you might be misinterpreted. Some people from Asian cultures, for example, are much less comfortable with being touched than those from other cultures, and many cultures find direct eye contact intimidating or disrespectful. Make an effort to understand the patient's family structure and support system, and try to incorporate family caregivers into treatment suggestions. Cultural understanding and clear communication with the patient can be the keys to providing age-specific care. In this program, we will now look more closely at age-specific care for neonates, young infants up to about 6 months, and older infants up to the age of 1 year. Age-specific care begins with neonates. The first 28 days of life are a time when the neonate's body functions, such as digestion, temperature regulation, and sleeping, adjust to life outside the womb. Neonates are starting to use all of their senses. They learn to focus their eyes and begin to smile in response to a smile. Neonates are in a state of total dependency. The startle or Moro reflex is one of the several reflexes neonates are born with to help cope with life outside the womb. The absence or impairment of the Moro reflex can indicate problems with the central nervous system. Normal reflexes such as grasping, gagging, and startling should be present in the neonate, and their absence or impairment requires further investigation. Other important concerns are age-appropriate vital signs, temperature, pulse, and respiration, steady weight gain, and in some cases, blood glucose levels. Abnormal results in any of these areas requires further intervention and diagnostic studies. Normal growth should be assessed using standardized growth charts. Growth charts developed by the CDC's National Center for Health Statistics are the most commonly used and will help identify variations from normal growth patterns. At this age, communication is largely a matter of a strong crying to express hunger or discomfort. The neonate will also smile randomly. Sometimes this may be genuine communication, a response to a smile offered, and sometimes simply a form of experimenting with the environment. Another kind of communication is a neonate's obvious enjoyment of being held, cuddled, touched, talked to, and smiled at. Even at this age, learning to communicate through touch is beginning. Always handle the neonate in a gentle, comforting, and soothing manner. Avoid overstimulation. Speak to the neonate in a soft, comforting voice.
Is it normal for him to sleep so much?
Help parents learn proper child care skills, including feeding, diapering, and bathing. Be sure parents understand that a neonate has immature heat regulation and needs to be kept warm. With changes in the healthcare system, neonates are going home earlier these days and sometimes with potential healthcare problems that haven't been identified. New parents should be taught about jaundice, breastfeeding and nutrition, cord care, fevers, and about avoiding sleeping positions associated with sudden infant death syndrome. Staff should always approach a neonate slowly and indirectly if possible. Your abrupt appearance can frighten them. If possible, examine the baby in the mother's arms. Be sure to warm a stethoscope or your hands before touching the infant so that it won't startle the infant. When you approach the parents or the primary caretaker, do it with a reassuring smile. If the opportunity arises, make a complimentary or reassuring comment about the neonate. Many new parents are frightened of their new responsibilities and can use all the learning and reassurance they can get. Before they leave the facility, help parents understand the importance of safety devices such as car seats. In most states, they are required by law. The current standard is to use a child seat in the back seat of the car and fasten it in place with both the lap and shoulder belt. If necessary, teach the parents how to use one. And be ready to answer lots of questions. New parents can easily feel overwhelmed and bewildered. Young infants from 4 weeks to about 6 months are in a period of rapid growth and learning. They explore the world through direct sensory contact by tasting, touching, looking, listening, and smelling. At first, they begin to follow objects with their eyes and smile more directly in response to stimulation. Later in this stage, they begin to respond differently to familiar versus unfamiliar objects. They may like to grasp and play with rattles and other easily grasped objects. Towards 6 months old, they are able to copy simple actions, and they often enjoy more active toys such as banging toys. And they progress in their efforts to communicate, moving from crying through babbling and cooing when they are talked to. Even at the earliest stage, an infant may look around in search of someone speaking. Infants learn to enjoy having others around and playing with them. When infants are brought in, ask the parents how often the infant is eating, what they are feeding the infant, any supplemental feedings, if there is any fussiness after feedings, or difficulty with feedings.
What other kind of things is she doing? Is she rolling over? Is she reaching? Is she grabbing for things?
Ask what the infant is trying to do, such as roll over, reach, and grab items. Does the infant respond and look towards noises? Does the infant track and follow the movement of an object with his or her eyes?
Any hearing or vision problems? Any concerns you have about that?
All of these are indicators that the infant is developing normal motor skills and may help to identify any hearing or vision problems.
That's great that you love to hold her because it's very important to develop a strong bond with your child.
A key issue at this age is to foster good child-parent bonds. It's important to continue educating the parents in caretaking skills, especially concerning feeding, diapering, and bathing.
Good to bathe her daily if you can.
And providers should help parents keep immunizations and checkups on schedule. Some of the nursing considerations remain similar to those for neonates. Try not to approach the infant too quickly or directly.
What are you doing? What you doing?
Smile and talk softly to the infant, not only to communicate your goodwill, but to model good parenting for the caretakers. The car seat remains a major safety consideration. Make sure the parents haven't grown lax about its use. It is not acceptable to strap an infant to a mother's lap or allow the mother to hold the infant in a moving car. There are many safety tips, such as supporting an infant's head for the first 3 or 4 months until they gain control. That may not be obvious to all parents, especially new parents.
Something that's really important, because Elsie is going to be moving around more and more, is child-proofing your home. We have some really good literature on this.
Help the parents understand how to baby-proof the environment at home. For younger infants, they should remove all objects that could be eaten or placed into small orifices, such as an ear or a nose. Remove cords and cover electrical outlets. Lock up chemicals and other dangerous substances. And explain that they should not leave the infant unattended on the floor or any other surface. Exploration is a natural tendency, so explain how the parents can encourage this and still be safe at the same time. One cupboard can be left unlocked with safe items, such as large plastic bowls and lids for the infant to explore. There are good baby-proofing guides available from government agencies or that can be downloaded from the internet. Make sure your institution has some available. After the age of 6 months, the infant is entering a very exciting period of discovering and learning and the development of motor and speech skills. At this age, they begin to respond to their own names. They copy sounds and make a great deal of progress in imitating adult sounds. They turn their head from side to side on hearing sounds, and they begin to show frustrations and strong fears of separation from caretakers.
Hey, Ryder.
The primary teeth usually begin to appear soon after 6 months.
It's okay.
And how did you treat that?
Look for and ask the parents about any signs of colds or flu, and remind the parents that these conditions are very common, especially among children who attend daycare. Hand washing as a way to prevent disease transmission should be emphasized to the parents and anyone providing care.
Look at you, Sid. You're being...
Communication becomes increasingly important at this age. Use the baby's name and encourage any form of communication. The baby should begin responding to his or her name and will also try to imitate adult sounds. By 9 months, many babies should begin saying mama and dada and playing peekaboo. The baby should also begin to shake the head to mean no and should respond to the word no from a caretaker.
No. No.
Smile and speak softly and help the parents to do the same. The baby will begin to let you know his or her feelings through crying, cooing, and babbling. The baby will also begin to demonstrate excitement, fears, frustrations, and other emotions such as jealousy and affection. When older infants are brought in, ask the parents if the infant seems to be developing motor skills normally and if they have noticed any hearing or vision problems.
Have you noticed anything unusual about his eyesight or hearing?
Remind parents that children develop at different speeds, and if the infant seems slow to crawl, reassure them it may be perfectly normal.
I see 2 teeth. Is there another one coming?
Check the infant's teeth and help the parents understand the essentials of basic tooth care, even for 1 or 2 teeth. Baby teeth usually emerge in pairs. First come the 2 lower central incisors, the 2 remaining lower incisors, and then the first molars. You will probably see the infant before any dentist does.
When teeth are coming in, it can be very uncomfortable. There's a couple of methods that you can use. This is a teething ring.
Explain to the parents the increased fussiness and other signs of teething and suggest plenty of fluids and a soft teething gel or a gel chew toy to help ease some of the pain of teething. Throughout infancy, encourage the child to communicate and encourage hugging, cuddling, and touch by staff and parents.
Physical contact and attention. And do you do a lot of cuddling with him at night? And
Yes.
All this will promote healthy bonds and good parenting. Be aware of the problem of stranger anxiety and try to limit the number of staff workers assigned to each infant. Always speak to the infant before a touch to avoid startling the infant. If the infant has a period of colic or other illness, be prepared for the parents to exhibit their own forms of stress. This may be seen as anger towards staff or demanding or suspicious behavior.
Well, he's up every hour. Like, I have been getting no sleep. Like, it's unbelievable. Is there anybody I can speak to? Do you have a manager? Like, this is ridiculous.
Always bear in mind the stress they may be suffering and remain polite and helpful.
It sounds like maybe he's been a little bit colicky.
Try to turn the discussion to more positive subjects, such as a direct discussion of the illness. Since the older infant is becoming much more mobile, crawling rapidly to every available corner, and may even be taking the first hesitant steps, safety becomes a paramount concern.
Ryder will be crawling, and you want to make sure to take certain steps that can keep him safe. And this pamphlet will tell you a little bit about that.
Help the parents understand crawl-proofing their home. Small or sharp objects need to be put out of reach. Lower cabinets in kitchens and bathrooms should be secured, especially those with cleaners and other chemicals. Stairs that can be a hazard need gates or other barriers, and the parents' own fragile valuables that they don't want broken should be put out of reach. As the infant begins to take the first steps, you may want to advise the parents to cushion any sharp corners that he or she could fall into. Get on your hands and knees and survey the room for other objects and hazards from the infant's point of view, and remove throw rugs that might slip easily. People grow and learn and change all their lives. Even an infant is an individual with his or her own special needs and feelings and thoughts and dislikes. But we all share the human condition too, and there is so much that we share with one another at every step of the journey. This program has been a guideline for the age-specific care for neonates and infants that will help you integrate age-specific care into your work with these ages. Later ages will be covered in other programs. Taken together, these will help you learn what you can offer your patients at just that moment in their journey when they need it most.